All right, and you're just in time for that discussion. Dr. Willis Akwale, Chairperson, COVID-19 Vaccine Task Force, is back with me in studio. Dr. Githinji Gitai, Global CEO, Amref Health Africa, is also joining us online. And Dr. Akwale, I'll start with you, and let's start off with the questions from the people. There's a lot that have been sent through. There's one from Okia Brian, who says, what is the level of COVID-19 testing and what happened to contact tracing strategy? How reliable and valid is the data being announced? And what sense can we make out of it?
Yeah, so I'll try to answer that, although really my main area is in vaccination. But what I know my colleagues at the Ministry of Health have been scaling up the testing. Yeah. You've seen testing going up and being ramped up as much as even 6,000–7,000 tests per day. And more test kits are being made available. Well, it could get better, but I strongly feel that the level of testing that we are doing now is it puts us in a very good position to be able to assess the level of the pandemic in this country now. Okay. And for me, it is very accurate. We report as it is, and it is what is used to make decisions about the pandemic.
The governors are now pushing to be allowed to purchase their own vaccines. Is that something that is worth considering?
Let me say something about the global situation about the vaccine. Yeah. Even if you have money running through your ears now, that does not guarantee you access to vaccines in the global market. The limiting factor is the production, is the manufacturing. So you have mechanisms like COVAX and the African Union that have already countries that have placed money there, but they are unable to access these particular vaccines. And by that I mean quality assured, WHO approved vaccines. These are in scarcity because I think this pandemic found us in a situation where globally the manufacturing was not there. The other point I would also like to raise, is that one of the considerations is that some of the raw materials used to manufacture some of the vaccines take quite a long time to be prepared and be ready to be used. Some of the so-called spike protein in some of the groups of adenoviral vector vaccines are grown within the laboratory. And it's just like maize. You do not just put it there and go and harvest the next day. So it takes time to be able to get the raw material to start even the production. Okay. So it's not a matter of money, and globally you can see countries have come together through the COVAX mechanism, 93 countries, so that they can access the vaccine. The African Union has come together. Yeah. So trying to go solo, you will walk a very long journey alone. Okay.
Dr. Gitai, jump in on this. More than a year down the line, how have we handled this pandemic in your view? What could be done better?
Hi, Trevor, and hi, Dr. Akwale. We obviously have not handled it in a completely optimal manner, but that doesn't mean we haven't done a good job. I think if you look across the African continent, Kenya is one of those countries that has had a very good and scientifically guided government response. That's government response in terms of policy, instructions, and also the measures that we need to take. As to whether the government has itself followed those measures, that's debatable. We have seen the political rallies, we've seen the big celebrations on Madaraka Day and all these things. So that's a different issue. In terms of policy, the government has actually done fairly well. The place where the government could have done better, and I still hope it can because we are not out of the woods yet, is engaging the people, community engagement, making sure that the response is driven by the government, but owned by the people. That means engaging the religious leaders, which the government has set up all the mechanisms, but I don't think we've had enough resources to go to the ground, get community health workers, get religious leaders, local leaders, to actually engage the people, not to force or enforce compliance, but engage the people. The other area that I would say the government has done fairly well, is in administration of existing vaccines. As Dr. Akwale has said, we have no vaccines anywhere, but Kenya received about 1 million plus, and we have seen Kenya vaccinate or use those vaccines up to almost 100%. We have countries that have a 25% absorption, even less than 25% absorption. So on many fronts, Kenya has done well, but we still have a lot to learn, especially now in the response. And finally, in improving the health system, we still have a long way to go as we wait for further escalation of the virus.
Yeah. Dr. Kwale, we are now looking at almost 3 vaccines. There's AstraZeneca, there's J&J, and then there's a potential Pfizer coming from the US now. Did you clarify that can we mix vaccines now or not?
So what I have said is that currently, as it is now, our priority is to ensure that everybody who got the first dose of AstraZeneca has a second dose. A first dose, as we told Kenyans, gives you partial protection of 60–70%. While you get the second dose, you now get full protection. When we are hearing of 4th wave, 5th wave, or whichever waves that are coming, you are better off when you are fully vaccinated. And you will see that now one of our indicators that we are tracking is those fully vaccinated. As we speak now, 200,000 Kenyans are fully vaccinated. So the priority with the doses we have is second dose. Now, the doses that are going to come, 10 million J&J starting from August, the Pfizer that we are also going to get, and any other that we may be able to bring on board will be to be used for a new cohort. Remember, the AstraZeneca will just give us slightly over 1 point something million. We still have tens of millions of Kenyans to vaccinate.
But are you concerned that the reaction might be different? Because we know AstraZeneca has not had a bit of an adverse reaction, but what about these other ones?
Every vaccine, when they are registered, there's a list of common side effects that are associated with it. Yeah. And then countries, using their regulatory bodies and also working very closely with the manufacturers, are required to look for any minor side effects. So the messenger RNA vaccines, which is like Pfizer, yes, they are known to give you a little bit of higher temperature. So Kenyans who use it should start expecting that, unlike AstraZeneca, you may get a little bit of that fever, a lot more than you would have got with AstraZeneca. But that does not mean that is a side effect that cannot be tolerated. It will be tolerated. You can use painkillers to bring it down. The issue of cross-reaction and other things, I don't think that has been documented, and it should not be a worry for Kenyans now.
Okay. Dr. Gitai, the governors are pushing to be allowed to purchase their own vaccines, and also their testing kits in the counties. Is this a good idea or a bad idea?
On one side, I would be very surprised if the governors have a source for the vaccines that are WHO approved for delivery to Kenya and that are available to be purchased. I would be completely surprised. If they do, they should be allowed to do so. And I would agree with Dr. Kwale. And knowing the global supply, I've just come from meetings on vaccine supply in Africa, and everyone doesn't know where to find them. You just have to wait for the bilateral and multilateral mechanism to deliver vaccines. But for the test kits, of course they should. And they should use the mechanism that exists, whether it's KEMSA or direct, whatever the law allows. The test, including PCR reagents, they should be able to purchase those, and including antigen, what we call the rapid antigen kits that are approved by the Ministry of Health and approved by WHO for rapid testing that takes about 15 to 30 minutes to test. The governors should apply their money, work with the national system, and procure those for themselves. But vaccines, well, best of luck. They wouldn't find them. Even if they are allowed, they wouldn't find them if we are focusing on the ones that are approved by WHO.
All right. Dr. Kwale, there's a concern that the vaccines that came in from Denmark are expiring on the 31st. That's about 8 days from now. Should this be an actual concern for Kenyans?
Not with the capacity that Kenya has in terms of vaccination, not with the demand that has been created, not with the queues that you've been seeing. And as I've said already, we've sent the vaccines to the regions. You realize that we have already listed over 650 facilities to vaccinate, but because of supply constraints, we are using about 200 to vaccinate. And at the best day, we've been able to vaccinate 48,000 people in a single day. So if we ramp up, and if and you see with the second dose, the advantage is already people made a decision. So they are basically just coming for the second dose.
Yeah.
Unlike the first one where we had to do a lot of talking and convincing for people to come. So for me, I am giving it maximum 3 weeks. There will be no more vaccines that we got yesterday. But possible that within 2 weeks, we'll have consumed them.
Okay. And now, Dr. Kwale, the other issue here is, would it be prudent to vaccinate only those who have not contracted COVID-19, considering that after you've gotten COVID-19, you have some level of immunity anyway, and we're talking about limited vaccines availability?
Well, that is a discussion and a dialogue that has been happening considering the season of scarcity that we are in now. That if you have had COVID, then one dose will be as good as somebody who has got 2 doses. That is the truth in the area of scarcity. But believe me you that we are moving from the season of scarcity to almost adequate. And any time after September this year, we could very easily be in the season of plenty. And therefore, you really need that full protection. And I know at a personal level, people will want to be sure they have got the full vaccination.
Yeah. So do you foresee by June maybe easing a bit of restrictions here and there if you manage to get the 60% vaccination that you're talking about? Even if it's not completely lifting them out, just easing them a little bit.
So as I've said, the decision as to measures that will be used to control this pandemic, first, the pandemic is very unpredictable. We don't know whether the Delta variant is the last that we are seeing. There could be another more lethal and vicious variant coming. God forbid that it does. We don't want that. We pray it doesn't happen. We could also get situations where maybe the variants like the Alpha variant could resurge. So coronaviruses can be that unpredictable, especially when they are in the pandemic mode.
Yeah.
And therefore, for me, it will be a very close monitoring. I think strengthening our surveillance, ensuring we scale up the testing, ensuring that we are able to continue with the measures that we are doing, and we ramp up our vaccination, which definitely we are planning to do. And as we monitor, then decisions can be made at the right time.
Yeah. Dr. Gitai, are there some things we did almost like robots, so to speak, that we should now probably rethink? Say the curfew hours, for example. Even at the airport, sometimes you see you're boarding in different zones and you're put aside, but then you go and sit together in the airplane. So are there certain things we need to reconsider now?
Well, let's say that all the measures that were taken during this pandemic have some scientific basis behind them. Each of the measures has a scientific basis. Let me start with the curfew that you said. When you say there's a curfew, you're basically saying there is a limited time lockdown. That's what a curfew is. A curfew is a limited time lockdown. You're saying that instead of locking down an economy or people socialize for 24 hours, lock it down for 8 hours. That's what a curfew is. So whether you're 10 to 4 or 7 to 4, you're basically saying these are hours of lockdown. Why? Because you can't, ideally you'd want to lock down for 24 hours, but you can't afford it in terms of people's social lives, livelihoods and lives. So you lock down for a shorter time and you choose the least productive time of the day. That's what a curfew is. That must continue because the value of the curfew is to reduce contact time and therefore reduce transmission. So it helps to actually protect the health system by reducing the numbers. Now the next thing is, when you go into some of these measures, again, there is scientific evidence that crowding is what brings the transmission rates high. So if you are in a crowd and you are in a queue, then there is contact, because you need to reduce contact and crowding. So if you do that, then when you go to the plane, you know, it's inevitable that you have to be inside there. Of course, the ideal would be to say no two people can sit next to each other, but there is minimal contact between crowded people. So all these are scientifically based. The thing is how we implement them, at what time, with which population, and what is the compliance rate.
All right. And Dr. Kwale, there's questions here from Twitter. Dr. William Tuaigize says, could Dr. Kwale tell us why the Danish people refused to use AstraZeneca on their people? Now they're busy dishing them out to Africans.
Yesterday, the Danish ambassador did give an explanation. And I think that notion that the vaccines are being dumped onto Africa is completely out of question. In fact, let me start locally. You know, even here, some counties were not using the vaccines. In the last 2 weeks, we've moved vaccines from one area to another. So you would not say, why was Marsabit not using, as it refused? So basically what happened is that, remember, a lot of the rich nation booked the supplies. They overbooked the supplies. And again, because they have money, they brought in other varieties of the vaccines. So they have a choice of Moderna, they have a choice of Pfizer, they have a choice of Novavax, they have a choice of AstraZeneca. And government can make a policy and say, for us as government, these are the ones we are procuring. And if you need the other one, you can get them through other channels, including the private sector. So AstraZeneca is an effective vaccine. You can see it has been compared with others, even in terms of the effect on the Delta variant, and it is working. The best vaccine is the one that is inside your arm. Going to debates, yet this is what is saving a lot of people, will not be productive for this country at this time.
All right. Dr. Gitahi, should we just go full throttle and involve the private sector and get them to have now start producing our own vaccines? What would it take for us to start producing our own vaccines?
So let me first correct something you said earlier, because I think I picked it and I forgot that the vaccines that we got are not expiring end of June. It's end of July. So that's important for the public to know. It's end of July, the one from Denmark. In terms of manufacturing, it is a very complex issue. I know the will and the desire and the intention of government is there. But there are many factors that we need to remember about the vaccine manufacturing. One is that we don't have our own technology or platform or whatever you may call it that we have actually developed. So we need that knowledge of the vaccines that have been developed and approved to be transferred. Otherwise, we can also start research our own, but it could take years to research it. So the easiest is to say, let us transfer knowledge from either Moderna, from AstraZeneca or Pfizer, transfer that knowledge into the country. That's number one. Secondly, we need the scientists and the experts for that knowledge to be transferred. Third, we need the technology for manufacturing to be transferred. And this is why you're hearing people saying, you know, we need to release the intellectual property for companies to transfer this knowledge. These are the issues. But then also you need money. You need money to build the factories that need to do this. They're not cheap, but the government can afford it. If the government said put $400 million aside to set up a plant, the government can do that. But finally, you need markets. You need to find out if you are going to construct a plant for COVID vaccines for $400 million or $500 million. Then COVID ends in a year or 2 years. What do you do with it? So you have to think around, is it being made only for COVID or for other vaccines? Yeah. And is it being made for Kenya only or for other countries in Africa? So there are so many considerations. Right now we know the African continent wants to manufacture vaccines. They are looking at the messenger RNA, which is Moderna or Pfizer. Yeah. There are knowledge transfer conversations happening, but we need to look holistically across the continent, not country by country.
All right. Dr. Kwale, what do you think is the biggest challenge for us to just start manufacturing our vaccines?
Actually, let me assure Kenyans that there is already a committee chaired by the Kenya Medical Research Institute. I happen to be a member. We've actually come up with a concept. We've already done a feasibility study. We've seen the possibilities. We've developed a business case. I cannot go into the details, but what I can assure Kenyans is that the principles that Dr. Gitahi Githinji is mentioned are our guiding principle towards that. We are looking for a partner that has already got a WHO-approved vaccine so that we partner for technological transfer. We will be looking at private sector with expertise to market the vaccine. And also more important is that, you know, Kenya has been depending on Gavi for the childhood vaccines, the measles, the polio, the diphtheria, and whooping cough. Part of the plan is that in 2 to 5 years, we will also be going towards the production of vaccines for childhood diseases.
Okay. So we can give a timeline to this on when we might start?
It is work in progress. A physical facility has been identified. It's being assessed by the Ministry of Works. Yeah. A team has been constituted. We are reaching out to sites that are already manufacturing, and teams will be going out there. It is actually, let me say, it is work in progress, and we'll be updating Kenyans in the coming few weeks.
Okay. Dr. Gitai, there's a pushback here. Kipleting Manuela says, well, government should revise the curfew time to 10 p.m. in Western and Lake Region counties. Small businesses have been affected negatively. Majority of them are counting heavy losses and our economy is hurting.
You see, the thing we must always remember is that health is wealth. Without health, you cannot have wealth. And if you want to protect wealth, you must protect health. So this is the debate that we always have. So whoever is pushing back is actually right. The question is, how many lives can you sacrifice for business? If you can actually tell me the number of lives you are ready to sacrifice for business, then we can kill that debate. But I don't think there's any life you want to sacrifice for business. Therefore, the question is, how can we limit the damage, the economic damage, the social damage, also by obeying the public health measures during the day so that we avoid the surges that are resulting to increase in curfew hours. So the question, and this is what I was talking about earlier, participatory response, so that even the public understands why you're doing what you're doing. Kenya is now facing a fourth wave, and I can tell you it's already started. Are we going to wait until we have people who can't find oxygen for us to say, hey, now we need the government to protect us? So we must work together.
All right. Dr. Kwale, there's a question here from Okia Brian, who says, what is the level of COVID-19 testing and what happened to contact tracing strategy and how reliable is the data that we have? I think you responded to this earlier on. Yes. There's another one where he says, if we have vaccinated only 1% of the population over 2 months, how long will we take to vaccinate the eligible population given our dependence on donations?
I've mentioned this to Kenyans, that we have diversified. So the global scarcity was expected and actually kind of projected to be more severe between the months of June, July, going to August. And as I've said, the supply situation is improving. The government is actually put in resources. Those who looked at the budget, they say 7 billion for this financial year, and there's a 14 billion budget provision for next financial year. So for us, actually, as a task force, we are preparing for that mass campaign immediately the 10 million doses deliveries begin. So we have done slow because there was scarcity. We are going for a season when we'll have adequate and we have the capacity to really scale up that. Yesterday, you had the Principal Secretary, Mrs. Susan Mochache, making it very clear that we can vaccinate up to 50,000 people per day.
All right. There's a final question here for you, and then I'll take closing remarks. Travis says they're spending money on purchasing a vaccine for the people they haven't tested. Before we have the vaccine, let them test the presence of the virus within the people first. What do you say?
I will ask Gitai Gidinju. We'll sit in the same task force, and I'm sure he has a very good answer to that. But I also,
I can answer that. Let me say that when we give children polio vaccine, when we give children measles, and you take your child to the doctor to be vaccinated, and we vaccinate all children under 5. We do not check whether they have measles. We do not check whether they have polio. So vaccines are not for those people who are infected by the disease. They are for protecting you against future infection. Let us just understand that, and then that question will be answered.
All right. Dr. Kwale, as it stands right now, what is the weakest link in this fight against COVID-19 from the assessment you've made over the year?
Yeah, so for me, I think first and foremost, the global response was not coordinated. This is a global pandemic. Leaving it for countries and regions and whatever it was the very first thing. If globally there had been a more coordinated response, so that even when we are talking of vaccines, there's equal access to the vaccines, things would have been better. Secondly, I think the whole issue of, testing and contact tracing in the very early stages was such a crucial thing that should have been supported again globally, and especially in countries that have limited resources. And I think the other thing is just the vicious nature. It's an unpredictable. The variants are changing. We don't know what they will do. We need to be a step ahead. At the moment, they seem to be one step ahead of us. But I believe the scientists are doing everything, and soon we'll catch up with this virus.
Okay. Dr. Gitai, there are many people here who are saying that we haven't even received the first vaccine and you people are talking about the second one. What is the plan going forward? And I know there's a global shortage, but as soon as the different one comes in, how will the rollout be? Will it be free for all, where you just go to the Ministry of Health and any hospital and get it? Or are you going to categorize it going forward the same way we started with the frontline workers and then the aged and the people who are vulnerable? What is the plan when we now finally get the millions of doses that are coming in?
So let me escalate that question to the chair of the COVID-19 vaccine committee. He is my chair. So over to you, Dr. Kwale.
Yes, we have a very clear plan. We have a very clear plan. We have again said that vaccination against COVID-19 is free of charge wherever you get it. And I want to tell Kenyans, even at these times when the vaccines are scarce, please do not pay for any vaccine and report to the nearest authority if anybody asks you to pay. And don't be duped to go to places where people will tell you, you pay this and you get your second dose. You will be getting, as the cabinet secretary said, it could as well be normal saline or water that you are being jabbed.
Yeah.
So that's first and foremost. But the plan is that immediately these vaccines start increasing in number, we are going to scale up the campaign. We are going to do outreaches. We are going to prioritize people with comorbidities, the people who have diseases that put them at very high risk. We are going to reach to the vulnerable population. We reach to the elderly people. There will be a whole mix of ensuring that we reach as many people as we can in the shortest time possible.
Yeah. Chair, do you think we are ready for a fourth wave should it hit?
Let me just give you some very quick statistics. You know, we already started the fourth wave, Trevor. If you look at Kenya's numbers and you do what we call a 7-day moving average, you take every 7 days and take an average and then you keep plotting, you will see that actually we've had a rise in that average between the last 7 days and these 7 days of 88%. That's based on our own data. The last 7 days moving average, this 7 days moving average, 88%. And the other thing is that that acceleration seems faster than the acceleration of the previous waves. When I look at how the others were accelerating, there's a significant difference. So this is steeper, okay? And that is the data that we have. So the fourth wave has started. As to when it peaks, we don't know. I'm sure the people who are modeling can tell us, but it started. So my message to Kenyans is, let us know that we are still in the battlefield. So please take care of yourselves, get vaccinated when you get access, and take care of yourself, wear your mask and take care of others. We are not out of the woods. We are actually headed to a more difficult period in July, August, and September.
Okay. Dr. Kwale, before I give both of you a chance for closing remarks on this discussion, I still see a lot of myths around here. There are some people who still don't want to take the vaccine. There are others who claim it is magnetic. How are you dealing with such myths?
So one of the things is that misinformation, rumors, and things like that are things we've dealt with. And in this country, I must say, we've done a fairly good job because the acceptance level has gone high. But we are not going to relent. Of course, there are people who will specialize in doing that. For us, we will be packaging and giving people the right information. We are going to do much better with communities as we move forward in terms of communication. We are going to package what we call frequently asked questions so that things like magnets, I don't know where they come in a vaccine, we'll address all those. So it shouldn't worry people. Really, when you go and see the queues here, Kenya has a fairly literate community, and they really like their health. That's why working in the Ministry of Health, we are always under pressure.
Yeah.
So the acceptance of the vaccine has been very encouraging.
All right. And Galaxy Girl here says, is in July too soon an expiry date for me to take my second dose?
Well, as Dr. Kwale has said, and I believe, looking at the way we have used the other vaccines, I believe we have capacity to actually use the 360,000 or so in the next 3 weeks. We have capacity. We have a lot of people who are looking for the vaccines, looking for their second dose. So I'm not worried at all. In terms of safety, can you take the vaccine up to the last day of expiry? Yes, completely 100% safe. So we have a long window up to end of July. I don't even think these vaccines will survive to mid-July, the batch of 360,000. So I wouldn't worry about expiry. I would worry about getting myself a place where I can get vaccinated, and getting my mother and my father and my grandmother and my uncle and my auntie to a place where they can get vaccinated.
All right, I'll give you both a chance for closing remarks, and Dr. Githinji, I'll start with you. What is your rallying call to Kenyans out there? Because there's some people who are claiming that there's a bit of COVID-19 apathy and a bit of reluctance going on now.
You know, today I had a meeting of our team across Africa, and the Ugandan team were very clear that they haven't seen anything like this for a long time. We have lost some of our staff in Uganda, and they are actually going through a very difficult time. So you do not want to test by jumping in the deep end when you don't know how deep it is. So take care of yourself. Taking COVID lightly is by deciding that you are going to cross the road with your eyes covered, and therefore you're not, without help or without cane or anything like that. So you're basically jumping into danger. And yet it doesn't cost you to take care of yourself. So let us take care of ourselves until we can get vaccinated. Let us take care of others until they can get vaccinated. We do not want to regret when we are burying our loved ones.
All right.
So let's take care of ourselves.
All right. Dr. Kwale, and also you can clarify the issue of even those who have gotten the 2 doses, it's not time for them to remove their masks, right? Some of them, I hear some of them walking around saying that they are now immune and they're okay. Dr. Kwale.
Absolutely. The vaccine does not stop transmission. The vaccine, as we've told Kenyans, is that it reduces your chance of developing severe disease and hospitalization. But when scaled up to a large scale, as we are seeing in other countries, the impact on transmission is being seen. We are still at a very low coverage in this country. Please protect yourself first before we really reach that level. We want to be alive to say that we were able to conquer COVID-19 by adhering to public health measures. What I want to tell Kenyans, the vaccines situation is going to improve. We apologize for any inconvenience because of the constraints which have been there. Some of you got SMSs, you turned up and it was not there. Things are going to get improved and things are going to get better and better. Make sure you get that vaccine. You better be fully vaccinated as we face surges and other waves as they come. Thank you.
Thank you so much, Dr. Willis Akwale, Chairperson, COVID-19 Vaccine Task Force, and Dr. Githinji Gitai, Global CEO, AMREF Health Africa, for speaking to us on this situation. It is something that is literally a matter of life and death. That's why we give it priority here at Citizen TV. My name is Trevor Mbija. It's always a pleasure having you with us here. We'll see you again tomorrow morning, all right? Good night. Bye for now.